Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me Dr. Hadidi, who has been on our program before, and we're glad to have him back this time to discuss a topic that he actually uh, uh, was at ASCO a discussant and educational session leader for. And this is the advent of increasing use of four-drug regimens for multiple myeloma. He's at the University of Arkansas, one of the leading myeloma centers in the country. So, welcome, Samir.
Thank you so much for having me.
So, Samir, so your topic at the ASCO meeting was what is the current state of induction with four drug regimens? And can you lay the background for your talk, and then we can dive into how you see the four drug regimens today?
Yes, certainly. In my multiple myeloma, we were lucky to see developments over the years, where a concept of addition of extra drugs on top of active drugs were entertained. So we started, checking three versus two drugs, and more recently four versus three drugs, to see if adding a new drug will result in better outcomes, but also, in tolerability that is similar to the three drugs. So what we actually did see over the years is the fact that nowadays multiple myeloma is becoming more of a chronic disease to many patients, where we see long-term survivors more often nowadays, and it's estimated there is more than one third of patients who may have this long disease control. And we expect this to be better with the use of four drugs. Now, when we refer to four drugs, we're referring to an anti-CD38 antibody, a proteasome inhibitor, immunomodulatory drug, and a steroid. Because the early results of such regimens did result in really deep responses as measured by minimal residual disease negativity, which reflects how deep is the response the patient achieves, and that was close to 40%, which is quite promising. I think the biggest questions that we have still is for how long should we use those four drugs? Should we use them for all patients regardless of their age and frailty? And what should we kind of use to govern the length of use? Is it fixed duration? Is it patient specific or disease specific?
So, how do you make up these four drug regimens?
So the four drug regimens is not a new concept. If you for example, one of the four drug regimens that was approved by the FDA but not used in